welcome everybody to this installment of the Bridge Book Club, where we're reading Self-Care, a Dynamic Approach to Integral Health. And we have with us the authors Fernanda Schweitzer and Mariana Schweitzer, who have presented, will talk us through parts of the books that we've been all diligently reading, of course, up to now. We're talking today about chapters 6 and chapter 7. The meeting is going to be is being recorded. I don't know. Anything else, Magali, that we need to let people know? No, I think that's about all. I'll pass over to whichever one of you two ladies will start off today.
Thank you, Kim. Hi, everybody. I'm really glad to be here today. One more step in our book, right? Chapter 6 and 7. And today is a very special day because we're talking about integration, integrative care, and co-development. How do I develop my care with the help of the specialists, the practitioners and professionals? And how do I integrate my desires, my feelings, and all together? So let's begin. Can we? Shall we? Good. Then, some ideas we are going to talk today are the framework for self-care, about competences and behaviors in self-caring, health technologies, how can we apply them, consciential health practice, about conscientiology and how we can consider another perspectives and paradigms in health practice, and the co-development of care. We begin with some WHO, World Health Organization materials, just to point that WHO is already working on this perspective too. It's not something aside out of the main health organizations. We are really talking about something. It's a desire for the WHO too. Then we can see the concept of self-care proposed by WHO. That is, self-care is the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a health worker. So making it by ourselves, it's self-care. It's okay. Making it with others, it's self-care too. It depends the way we do it, right? And we have the self-care interventions that are tools to support self-care. And this framework, these big circles we are seeing here, are the self-care interventions. In the middle, we have the self-care. We have ourselves, right? And then we have some principles of some key principles of holistic life course, that means the whole life included, right? The ethics, the gender equality, and the human rights. Then we have the place of access. Where can we get this? At home, at traditional medicine and social cultural practices, at community, and digital technologies, health services, what means in every place, right? And we have enabling environments. What we need to make it work. We need a trained health workforce, a regulated quality products and interventions. So we need to regulate some offers because we need to have quality and the right application for that. We have the health financing, education, and so on. A lot of environments we need to promote to have it, right? And the accountability. Who is going to be part of it, right? The private sector, individual, and responsibilities each one has about it. So, of course, it's a framework that is really huge, right? It's really complex to offer in a community, and it doesn't work if this community is not mature to deal with this situations and conditions, then, but it doesn't mean we are not looking for it. We are, but we need some time. And this is a material from 2022. And now we're going to see some material from 2023, kind of brand new, right? And that WHO brought. And it's about how we prepare professionals to support self-care. It's 3 volumes about this perspective. And then we have some domains and competences and behaviors to support self-care professionals would be trained and prepared for, but we can also look in this perspective of ourselves being prepared to take care of our own health. We need this perspective of people-centeredness. This is the main one, which means we are in the center, not the productivity, not my work, not my job, not some social obligation. People are in the middle, in the center. We need also to be prepared for decision making, to make choices, good choices, informed, technical choices. We need to know how to communicate, to give information, to look for information, to make the best decision, to collaborate, because we cannot promote this whole perspective just by one professional, just one person alone, even though we cannot ourselves do it alone, right? We need the experts to make it work. Then we have the evidence-informed practice, which means what is more indicated or in the middle of this solution. What is the best solution, the best options? What can I have to choose between what, and what can I lose? What can I gain in each decision? And we have the personal conduct, which means the person decides. It's we are free to choose, because I'm not sure if you have already felt that, but sometimes we go in a professional, a physician maybe, or any other practitioner, and they tell us what is right to do, right? Did you feel that? Like, you have no options. I was talking with some a friend yesterday, and she said, oh, the dentist said there's no other way I can treat that, but there was. She found another way, a less aggressive way to deal with her problem. It was a cyst in her mouth, but then it was her choice, and we need to practice this. It's my choice. I'm in the center, and let's look for the options we are going to choose. And then we have a model to try to comprehend better the health system and how it should be to support people's self-care. Because we have in gray here, these circles, we have the governance and information. It's in the middle of our lives. But we are in the center, and we connect with health force and with service delivery all the time in a direct influence. And also we connect with the medicines and technologies and the financing in an indirect influence. Yes, Kim, please.
I was wondering if you could speak a bit about, because that example that you just gave, I think, is so common. You can have so many conversations with people about going to a doctor, and the doctor just tells you blah 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 blah, this is how it is, and it's not very empowering. Often visiting a doctor is not a very empowering experience. And then what you're describing here these ideas, I mean, they're not from the WHO, but I guess they've been put together and they're represented there. But how does these, like, can you speak to how the WHO ideas or summaries, policies, and so on can feed back or do feed back into actual health systems in countries? Because the WHO doesn't offer health services, I don't think, unless they do it in emergencies, but I don't think they do at all, right? They just offer policy and
Yes, of course. And this is why this material, all these publications are made, because we are trying to bend the healthcare structure system. The WHO is trying to bend it to this direction, to support self-care. And it's really difficult, not because the professionals don't want to do this. It's just because they don't know, or they are not educated to do this. These materials, the third volume, Kim, of this collection, these three materials, are about how do we teach this in the universities for the professionals. So it's a really new process. Even though some unis already do this, but it's not in a structure and global way. So we are beginning to make some movements to make it work. Even though we as users of the service, we can have this interest and look for professionals that already try to work in this way. Could you share something, Mary, about uni experiences you are on?
Yes, of course. It's a very good question, Kim. And during this presentation and in the book, we try to explain the tools that different countries are using, or based on these guidelines, because WHO gives guidelines and gives, offers for the state members to apply these guidelines. Because as you said, they do not completely offer, but they can help the countries to subsidize these actions, and especially these tools that we will explain in further our presentation, how we can manage to do that. And for me, for example, I have this experience with my medical students to bring to them how do they develop their self-care, so they can have the opportunity to offer these actions or these tools we present, but also how they can put together actions with the patient to put the patient-centered care. So these are many ideas from different countries that are put together in these guidelines. So Fernanda said, very important to see this movement.
Yeah. And this is a very interesting idea, because if the student doesn't learn to do it to themselves, they don't know how to do it to others. And the structure of at least the physician university is really tough, really hard. So it doesn't work well with this perspective of self-care. But it's changing, because we're having a lot of suicides in students, for example. It's a hard reality, but it's happening even in Brazil. So it's changing this process. The professionals, the professors need to change also. It doesn't work anymore the way I learned it, for example, very constrained and with a lot of shame. It doesn't work anymore. The students are not allowing this anymore.
So just another question about how is this self-care in education? I mean, not only at the university, but also to educate the population,
Yes.
I don't know that it happens, or...
We have our some propositions too by UNESCO. We are going to present some of them today. It's about life skills students need to deal with their own health. We are going to present it in a while, but we have it too. Yes, it's
Yes,
still, and the schools are beginning to work with that too, because kids are really suffering with bullying and other situations, and to have this solution, they need more emotional abilities.
Yeah. It seems that is a culture. What you're talking about is a change a whole culture of you know, of care, of self-care is not more
Yeah.
the care that comes from outside, but also how the society that we live is ill in certain ways. What you see is a society that put people to work a lot. Stress is something common in our society, and then go there and take medicines or take someone to prescribe something for you to get better. And then that many times what we see is the person that enters in this circle is getting worse, worse and worse, right? So
Yes.
it's
This is the main course of life, but we already see some initiatives to make a change, like our own here, right? Like talking about this. So we can change it a little.
Yes, and it's difficult. It's not easy to change this culture. We've seen it when, for example, when I get the fifth year students, they're in the fifth year of university, and they're all produced, and all their education is to tell people what to do. And then when we start to tell to them to build together the self-care, because it's really hard when someone tells you what to do, they're like, okay, what's happening now? And then at the beginning, they really feel lost. And it's like us when you tell your patient, okay, how do you want to do this? And they're like, oh, you're not going to tell me? And it's like, no, we're building this together. Be like, oh, but all my life I have been to physicians, nurses, and they're telling me what to do. And now I need to build up. I don't get it. So at first it's this, weird feeling. But then as we grow, especially when we are in the primary healthcare units, and then we build together with the patient, the family, the community, at the end, it really changes everything, because everybody is empowered, everybody is together in this process of, taking care. So it's really beautiful, really, really nice. And many practices have been doing this in the past 20 years or so. So it's a change, small change. Sorry, Fernanda, go ahead. Yes.
No, yeah, it's in the middle of this discussion. So
Yes.
the world is changing. It's not about
Yes.
just what we desire. The world is changing. The world is living in a healthcare crisis, and we can talk about it. And we would like to invite you to make our first group activity about what do we look for when we look for a professional, and we'd like you to make a list of 5 professional skills you most desire when you contact with health system, and what are your reaction and strategies when these skills are missing. Oh, it's not too flexible as I would like to. How do I deal with it? Or he doesn't explain very well. Or how do you deal? How do you react? Oh, I get angry. I get sad. I want to go out and never come back. How do you react? And let's share this in groups later. Okay? So please take your time, make your list. Have you already prepared your lists? Okay. Does anybody need once more time? It's okay. Can you go to groups then? Everybody come back, so it's a good sign, right?
Yeah, that's true. You're muted, Magali.
And we always feel like we want more time to talk, right? Oh no,
Yeah.
I just remembered this. Oh, and I want to share this. It's very special, this little moment.
Yeah, I already changed to all participants can share the screen, and now I'm gonna allow you to be the maker host. You're a host now.
I'll try.
Oh, it's good. It's good, Fernanda.
It's correct. Good. So let's talk a little bit more. Then we go to our second moment of a group activity. Then we can conclude our ideas, right? And as we are talking about behaviors, let's talk a little bit about technologies, because health technologies, about what types of health technologies do we know? What types of health technologies do you know? What could be considered a health technology? Which one do we use more often? Maybe because, for example, I don't use I use a thermometer usually, but I don't use a tomo or a magnetic resonance. Is that correct in English? Usually, right? And which collateral effects could they cause, right? So let's talk a little bit about that here. So we have we have a model of health technologies that's split in three parts: a light one about behavior, empathy, communication, embracement, our ability, emotional ability, intelligences. We have the light hard ones about knowledge, technical knowledge, our guidelines, checklists, our consultations. And we have the hard ones, like the equipments. So the thermometer, the X-ray, the tomo, all the hard stuffs we could consider. And usually we just think about techs. When we think about technologies, we think about the hard ones, the more complex ones. But we have another technologies. We are talking, it's so hard to find out a doctor, for example, that knows how to communicate and to let us decide our own treatment, because they don't have this light technology. They didn't learn how to do this to themselves and to others. And we also have this light hard technology. How do we use all the information we have access? Mariana have showed us a lot about evidence maps and self-care products we could apply, but how do we use and apply this and talk about it and use it with the hard equipment? So this is very difficult to balance these three technologies. Yes, Kim.
I just wanted to check when you said light, whether you meant easy, or do you mean
soft, subtle,
soft, like soft?
Yeah.
Yeah, okay. I think soft would probably be the word.
Most applicable.
Okay. Is
Yes.
food in there as a soft food?
Food, yeah. Food would be more, I believe, in. Oh, it's missing some. The ability to apply food in a proper way would be a light hard ability, because it's a knowledge you apply. The food itself, it would be a hard, because it doesn't have any life, but the ability to apply this is the hard point, right? It's the complex point. So as we can consider this light, hards, and hard technologies, or soft, subtles, and more physical technologies, we could say that too, we must balance this in our conditions, because, for example, in Brazil, people just consider health to have access to hard technologies. Oh, if I have access to exams, to X-rays. And if I go to the doctor and I don't, and he or she doesn't give me an exam to do, oh, it's not a good doctor. And sometimes we think that way too. If I don't do an exam, it's not a good perspective of health. I'm not being cared, right? And it's harder to, it's more complex to evaluate a professional by their ability to apply the soft and soft hard technologies. How do they manage their knowledge and the knowledge it's offered, and how do they apply these abilities? And this is what we're going to go deeper now. How do we practice in a consciential perspective? How can we consider these soft technologies, the subtle technologies, and go and look for these ones instead of just being connected with the harder informations? And maybe it looks a little bit far from ourselves, but I want to give some examples, right? Let's go back a little bit to talk about it. Sometimes we say, oh, my diagnosis is blah, blah, blah. And this diagnosis probably comes from a hard technology. I made an exam that told me I have a bursitis, encephalitis, meningitis, some itis, and these are my diagnoses. But this is the only diagnosis do I have in this situation, for example? Or there are another conditions, softer ones, I need to consider. For example, I'm reading a book about trauma, and he likes to say, people don't die of what they told us. For example, a car crash. No, it was abuse when he was a kid that made her drink a lot and be alcoholic. And then we have a car crash. So what's in the softer parts of our diagnosis? What brought us to that situation? Maybe in our way of living. And then we can transform this way of living. That was Magali's question. How do we teach everybody about it, right? So let's talk about this in a perspective of our consciousness. Mary, can I read to you?
Yes. And it's very interesting when we talk about health technologies, because usually people really can conceive the X-ray, the thermometer, as you said, but it's really hard. And what we want when we look for a physician is that we want someone with a good humor, with the capability of listening, with the possible competence of developing autonomy. And the light hard technology, it's what happens inside a consultation practice, or within a movement of therapy, or any kind of interaction between a healthcare practitioner and this patient or this community or this family. So it's really hard to do this. And one of our colleagues, Miki, shared, and when they don't know what to do, they just say, oh, it's not mine. And then they don't give me any other solution or where to find help or where to go. So when we think this in a consciential health practice approach, we think about this polynomial: welcoming, clarification, referral, and follow-up. And this is so wonderful, how we could put all these words together and bring us options to really welcome the thing that the person wants to work on, and really develop the listening. Okay, so what do you want? Oh, let's clarify. So you need this, or you want this. And then you can do referral for a practice, referral for changing our lifestyle, and then follow up. Do not abandon the person. Follow up. How are you doing? Oh, did you try this new thing? And then how it ended up? How did you work with that? And this goes to any approach. It can be for food. It can be for exercise. It can be for doing vibrational states. The person started to do it because she felt like when she arrived at her work, she felt really tired. or when she interacts with someone, she feels really tired. And then she feels like her energy is being drained out. And then she can start, to do the vibrational state when she realizes it, and then how she feels about it, and then referral. So this is really interesting for us. And one aspect of this is this concept of universal embracement. And this is for everybody to think about it, because it's a posture, a position, or a condition of the lucid, conciliatory, and fraternal conscience in is existentiality, receiving inter or extra physical consciousness. So not only the intraphysical one, but the extra-physical, granting resolutive attention sustained by their self, auto-transformation, and principles of cosmology. Okay, don't worry, we will explain this in pieces, but this concept of universal embracement, it's really important for us because it brings everybody to this welcoming approach and the importance of referral and follow-up. So when we bring this in the book, this is also from a verbete. This is also in the Encyclopedia of Conscientiality if you want to look deeper on. And Fernanda, can you please go to the next slide? And what we think about universal embracement, it's really interesting because there are things that facilitate it and there are things that are hiders. So how are you? How do you feel you are, really listening to people? Do you have, for example, very rare friendships or energetic self-control, evolutionary conviviality, empathy? You really want this in a position, but can you do it also? It's so hard to do it. There are many, practices to help us develop empathy. Are you good in extended listening? Or do you already want to give somebody a solution when they start to talk what they are, passing through? How are you with gratitude, health habits, orthotranscend, proactivity, protagonism, responsibility, serenity, and secrecy? Oh, this is a really hard one. Sometimes people really enjoy not, gossiping and doing things. So the complete opposite of the table, it's the hindrance, or what it makes it really difficult. For example, friendships that are not in a way that evolves, or energetic decompensation, selfish conviviality, apathy, inattentive listening, cell phones all the time. How do you work with that? Misunderstanding, addictions, pathogens, defensiveness, victimization, guilt. How do you deal with it? Precipitation. These are all things that could difficult our ability to connect with people and to really listen and to embrace and to, give feedback and follow up. So when we first presented this talk, this idea of universal embracement, people were like, "Oh, I do that." But do you really do it in all aspects with only the people that you like first, and then with the people that you dislike a little bit, and then you connect with the idea that consciousness is part of everybody and everybody's connected? So how deep you go in this process of embracement? Am I good at embracing others, but not as good embracing myself? This is very, very common. How do I listen to myself and everything? So to help you think about it, we have an exercise. And can you please fast forward, Fernanda? To make us, help us to deal with all the 10 core life skills recommended by WHO. We were talking about where do we use all of these, how we can bring this idea for all people in different communities. Well, the way that we have seen the most, it's by developing life skills. And these are the 10 life skills WHO develops and invites people to, work on. And universal embracement can really help with life skills because, when you're thinking about problem solving, critical thinking, effective communication skills and decision making, creative thinking, interpersonal relationship skills, this is very difficult. Self-awareness building skills, empathy, coping with stress, and coping with emotions. So for me, for example, one of these life skills I do have better, others I'm still trying to work on. I was sharing with people when the person is not listening to me, or when the physician or the nurse is not really, embracing me, I feel like I don't want to talk more. So I need to have another option to be able to speak in this group. So when we put together the universal embracement and the top 4 life skills, we have a lot of work to do. Okay, so how am I going to do this? And what we have seen so far is that when we invest in children and in adolescents to develop their life skills, we have better health outcomes. They compare, there's a recent publication where they compare how we develop mindfulness for kids at school and how we develop life skills. And we have better outcomes. We develop life skills because we help them with tools for all the areas of their life. So if they have a problem with their parents or a friend, they will work in their communication. We will talk about non-violent communication in this time today, and we'll talk about how we, develop critical thinking and all of these life skills. They are all connected, and when we start to work in one of those, we will also help the other one. So this is very interesting for us. So it's not easy, but we have seen, and Fernanda and I, we worked in a comic book for adolescents, and we present all of these life skills as, activities that people should develop and try to do it, and especially for adolescents, but it's actually for the whole family. So I hope people enjoy. Probably by the end of this year, it will be published and everybody can use it. It was a project from the Ministry of Health because they really want to do this with adolescents. So that's good.
So this 10 life skills, Magali, were the 10 I was talking to you about UNESCO, because it was developed with UNESCO, and UNESCO has 4 pillars to education. One of them is learning to be yourself, learning to be a person, and it's part of this idea of teaching this in schools, not just hard abilities like learning and processing and making decisions, but also to deal with social abilities and personal abilities. And we still don't have it much in schools, but people are looking for it somehow.
No, we have seen grow, and especially schools with this curriculum, because if we put it as extracurriculum, the people that like it will do it, but the people that really need it will not have contact. So what I have seen is that this needs to be part of the curriculum of people and children and universities. And so far we have seen growing, and the evidence, it's really showing it really helps. So this is really good too. So how about we talk a little bit about this? Do you think it's a good plan for next discuss groups? No? Okay. So we have some questions for you. So maybe you want to do a list of the 3 facilitators and hiders of embracement you identify in yourself. Or if you don't want to, you can do it with the life skills if it's like too much. And how do you miss to apply any light or light hard text to yourself? So when we talk about the universal embracement, this is a light technology. And when we talk about technologies, if you are having difficulty to think about what is a hard one, what's a soft one, so a hard one will be able to carry on like in a purse. It will be an X-ray. It's not going to be a big purse, but it's a that thing. And then the light one, it's one that is part of a person that she can do with herself and the others, but especially with themselves. And the light heart, it's how we use all the information, everything that we learned, and apply it. So if you like it, the soft is something that you develop by yourself, and then the light heart, how you apply it, and then the hard one, it's like the technology that is like dead or in a building, or you can carry on a suitcase. So just to help to you, it's like 3 suitcases that everybody needs to do. One is like for the hard ones, the other one is for this interaction, the other one is how you develop yourself. That's why it's so important to develop life skills. If you want to have professionals that really can listen, have empathy, and be able to communicate with others. So this is how this is all connected. So when you have this, and then do you want to apply this? And then we can share how we look at this. So maybe we can go back one slide, Fernanda, to show, yeah, this one, yeah. So make a list of this, the ones that you want to, work on or see that you are very good on.
Okay. Yeah.
I think we are all back, and we just have one more part of speaking and then one last exercise so we can finish up in time. I'm trying to hurry up a little bit just so we can finish in time. But thank you so much for your sharing for this last exercise. And what we want to work on now is by thinking of what you expect from an interaction with the healthcare professional and what do they usually offer regarding self-care. So we talk about soft skills, we talk about life skills, how these present now in self-care. So let's see, Fernanda, another slide, please. When we think about the education and what we want to bring for the individual capacity development through competency, this is the graphic that it shows the individual capacity together with interpersonal, and technical. So when we think about technical, we are talking about skills and device use, consultation skills. So when we talk to this professional, please do not interrupt the patient in the first 2 minutes. Let them talk about, learn how to use the x-ray. This is all technical. When we talk about interpersonal, it's the collaboration skills, the ability to communicate. It's very difficult. It's not easy to communicate with others, to communicate with ourselves, and also the intrapersonal individual capacity. And that's where we bring the self-management skills, the critical self-reflection, ethical practice, to really think about your practice. Ethics is putting in practice what you really understand, and also evidence-based practice. So we need to look what's new in the evidence and the research area, and then really try to apply it. So when we put together all these 3 areas of individual capacity, that's when we want to develop self-care. So let's see the next slide. And then when we want to use this for the co-development of self-care, we are thinking about some strategies. So when we try to apply all of these capacities, we can develop what we call in Brazil as anti-protocol. It's not that everybody will have the same way of treating themselves, even if they have the same disease. Diabetes for a young person, for an older person is different. Diabetes for a family with 10 people and with only some person, that will be different. And there's also amplified clinic to increase autonomy of the person, the family, the community, by increasing resources to provide for the health. And there's also singular therapeutic projects. It's an action plan to jointly develop between health team and family the best way to care. So all of these are practices that we have seen developed here in Brazil, but also in other countries when we talk about patient-centered care. That's what we're talking about for the development of care. And the very difficult one is therapeutic exemplarity. How do the professionals, the healthcare professionals, really apply this to their care, and then it helps other people care. So these are some of the practices we talk about in the book, but we want to bring this now too, because of the next slide, please, Fernanda. When you talk about the co-development of care and these practices, we have suggestions, anti-protocol suggestions, that we can avoid pastoral and culpable recommendations. We know when we talk to a person, oh yeah, that's because you smoke, that's why you have this. Wait, we need to understand why the person smoked, what was going on with their lives. Reinforced multi-factor diseases will not have only one unique cause. And then all of these suggestions will help to negotiate restrictions without rancor and take into account patients' values and investments, the ability to work with others, to specify offers for each person. Let's see with these many options, what is that you want to apply? Avoid initiation pairings by questioning affections and behaviors. That's not the way. You don't start to build self-care by asking, oh, why do you do that? Oh, why do you act like this? So we really need to value quality of life, ask the patient to understand what he understood about what you said about their illness and medication. Avoid saying always or never, prefer the concept of possibility. Avoid frightening the patient. This is what we call the preventive approach. Not to scare them. Let's see how it goes. And remember that chronic disease cannot be the only concern of their life. It's really hard to have a diagnosis. How do we go from that? How do we balance the fight against disease with production of life? Avoid medicalization of life. That's it. You're getting older, so that's why. No, older is part of life. Let's not medicalize everything. Acting morbid events with maximum support and minimal medication, and prefer phytotherapy to diazepines whenever possible. There's evidence for that. Let's use more phytotherapy. So these are suggestions that we want to bring with, this is from a physician here in Brazil, and it's really usable for all kinds of areas in the healthcare. So to continue this, the anti-protocol suggestion, I hope you like it and I hope you can apply. Do you remember receiving any of these suggestions? Have you ever received this? Oh, yes, someone told me it's my fault. Oh, yes, they told me this chronic disease I have, there's only one fault. So this is our last exercise. And we want you to think about this suggestion. So maybe we can come back. This will be like 5 minutes only, otherwise you will lose the time. But just point out one. And then if you did one of these thinking already, have you done it? So maybe we can go back, Fernando, to the suggestions and think about it. What do you think? Yeah. When I talked about it, did you remember one time that you received one of those? Have you ever primed someone of their behavior, of their disease or something? We usually do that, even if you don't want to, with the best of intentions.
Can I ask why it's called an anti-protocol? What's
Yes,
it
that's
against?
very good. It's against this idea of protocols. So Tenorio Cunha is the name of this physician, and he was so tired of guidelines and what to do because he was a family physician. He was someone that was in the primary healthcare practice, and he was like, these guidelines do not apply for my patients within their families, or if they don't have the money to buy all the good food and they want to, divide everything. So we need to really be careful when we want to do this. That's why he proposed anti-protocol.
So there are
Yeah.
guidelines on how to not be stuck by guidelines.
Yeah.
Yeah, that makes sense.
So maybe we can go 5 minutes break rooms. What do you think, Kim? Is that okay? Yeah, so we can go back. Yeah. Do we have only 2 more minutes? I'm sorry. What is our deadline? We got very excited for this meeting today, so I think we put too much material.
No, I actually, Magali, do we go for an hour and a half or an hour and 45? You're muted.
You can go for an hour 45. There's no problem.
Oh.
I
Yeah.
heard it.
Oh, good.
So,
I think that
Thank you.
that has been the time. So we have another 15 minutes.
Oh, that's perfect. We can work on that. Because me and Fernando, we have this finishing of our talking today. And we want to, after thinking about these protocols, and thank you so much for sharing. It was very interesting to hear your perceptions about it. We want to give you some tools to help in this last step. So Fernando, if you want to present how should we talk to the patient. So, okay, we've seen what does not work. So what should we do when we want to be heard and when we want to interact with people that have some ill or something? So the first question, it will be like, why do you think you got sick? The meaning of the disease for the patient, how the patient feels about the disease, how the problems affect their life. To know the singularities of the person, the fears, the angers, the manias, and the temperament, how is their sleep, their dreams, and to assess whether there is a denial of the disease, what autonomy capacity and possible secondary gains from the disease, to identify what feelings the professionals developed by the patient during the meeting, and the limits and the possibilities for the clinical relationship. Okay, I'm not able to connect with this patient. I'm doing interactions that are not good for me. Let's pass to another one. This can happen. That's okay. Contra referral is something real. Sometimes there will be this patient that the profession will be like, oh, this is just like my mother. This is just like an older patient. I cannot interact with him. And the last one is to know the patient's projects and dreams, desires, and leisure activities from the present and from the past. Do not focus only in the moment that they are sick. Think about what else do they want to do? How is their life beyond the problem or the health problem they're having? So these are ways to better talk to people when they have illness, and to talk with ourselves too, because we do not need to focus only in the disease. And you have another slide about how another ways and how should we communicate. And one approach to communicate, you can pass the slide, please, Fernanda, is when we think about non-violent communication. I don't know if everybody heard about it, but this was created by an American psychologist, Marshall Rosenberg. And the method is very simple. It is structured in 4 steps. And have someone heard about it? Did anyone apply it already? Or yeah, so is it? Yeah. So just to our people that will listen to it before, after this talk, in the first step of non-violent communication, we need to observe what is happening in a situation without judging what we are seeing, what the others are said or done, and how we realize that what is observed enriches our life or not. And this is the tricky part. The trick is to be able to articulate this observation without making any judgment. And this is really hard, or not to evaluate and simply thinking about what we like and don't like about what people are doing or saying. Because then we can go to the second step and we identify how we feel when we observe that action. Do we feel hurt? Do we feel scared, happy, amused? And the third step, we must recognize which of our needs are linked to the feelings we identify. And this is why we need to develop emotional intelligence, because we need to understand our feelings and then our needs, differentiate. And then the fourth step, to focus on what we are wanting and help us to say what we want from the other person. So it will help us to reach our lives and make it more wonderful, and to improve our communication relationships. So observe, feeling, needs, and requests. This is seems in the first moment to be very difficult and very hard to do, but with time you can try to apply it in small moments of lucidity, or when you're feeling that the person that you are connected is easier to apply this non-violent communication. And with over time, you will see this in all aspects of your life. So it's very interesting. And maybe if you heard about it before, you shared moments about it. So these are options for communication. One of the life skills we talked about it, and very important for the full development of care. Otherwise, you get to a physician and they will be, saying to you what to do, and then get the prescriptions, and then you don't do anything, and then you don't come back, or you stop looking for physicians. So this is to help us to better communicate, and sometimes just change the group of practitioners we are working on, and then, look for another one that really listen to us, and we can share our thoughts and our feelings. And I hope you enjoyed. Yeah, this is something we wanted to bring it to you, Fernanda. Also have used nonviolent communication.
And,
Yeah.
and we can use it also with our inside dialogue. For example, if I have a back pain, what's going on? What do I feel? What emotions? What are my needs? Oh, I need to go back to work fast. Oh, this is not so people-centered. So we can process these perspectives in a because we are usually a little bit violent with ourselves when we are sick and we feel impotent and incapable of something. So we can try to deal with this communication in your own mind. What are my requests to myself? We can talk about this in inner perspective, right? To practice it a little more. To remember we have some limits and circumstances we cannot change, even though we would like to. Our frustration and our desires. And I'll come back just one slide to remember, because these questions, I really do like them to make to myself, because when I cannot make something, or I don't see any progress in my health perspective, I usually try to check if I have secondary gains, or if I'm trying to go too fast in the way I comprehend my body, right? My temperament of having everything in this moment. And why this is so important. The question number 6, what are my projects and dreams? I'm trying to be an integral person, or I'm trying to be just productive and ready and do things as people expect me to do. So I do really like these questions. I hope they are used. Probably you use some of them, but it's like a way to connect with this integrality, right? And we also have some multidimensional care practices that we could consider in conscientiology. Some of them, if you or who are watching us don't know them properly, can look for Isaac Materials website and know in a proper way, because we have a vibrational state, make the energies vibrate to make us better. We have some parapsychic signals, insights and informations about energy in our body. We can use to have more perspective, knowledge of what's going on in our body and in our other bodies. We have the Simons, that is a process of assimilating and disassimilating energies, and it's usually connected with burnout, for example. We have some other practice like Bates, parapsychism, and out-of-body projections. And we are not going to explain in details all of them here, but it's good to consider them as in the way of taking care of each other and ourselves. We have the Penta practices that we donate energies every day at the same time to help other people. We have also the Ophiacs, that is a very advanced Penta practice. And we have this receiving our renewing, interconsciential renewing. How do we do this in a multi-existential process? And also, even though when we leave this body, after we die or decimate, we have other opportunities to take care of ourselves too. We can prepare ourselves to this moment. And what is important here is not just using these practices or technologies, right? These are techs we can apply to, not just to balance our health, but to get information, to get connection, and to comprehend better in our health condition in a consciential way. So
There is one that I'm not seeing here that is parasurgery. That is also a
very
technique.
important. Yes, the parasurgery, Magali. And people can also ask for parasurgery. It can be made in a place we can go, or we can just ask and make on a distance parasurgery. It's important too.
And it's not oh no, go ahead. It's just to say that it's not in this list because in the book you have another part where we describe it. And if anyone wants to look at Ectolab, it's where you can ask to receive parasurgery or to participate in a practice of parasurgery, or there is a gift from OIC that's also related to this. Go ahead, Mika.
Oh, I just wanted to add from my experience that there are para clinics or para hospitals, or how it is said in other knowledges, healing temples, where you can go to heal yourself or to help the other ones to be healed over there with very specialized helpers. I mean, I use them from time to time, and it's really helping me.
It's important, and usually it's an experience we can comprehend better with that when we are more used with out-of-body projections, right?
Yes,
So
and
the nights are not just a moment we stop. It's just a very useful moment we can apply to ourselves. Right? So we are almost in the end of our meeting today, and we would like to reaffirm and remember our challenges here of self-consciousness about our body, our emotions, to develop a self-awareness, to broaden health and care conceptions, to try different evidence-based ways of caring, and to develop self-research and self-care. These are the way we're trying to achieve here. And for that, we have some self-work again, right? The self-work until June 15th. We are going to read chapter 8 about self-care, the main chapter of the book, and chapter 9, self-awareness and self-research. How do we can broaden this in other perspectives of evolution? Please make notes. Please use your pen and pencil in your book or whatever you like to do. Try to practice the polynomial, welcoming, clarification, referral, follow-up, and try to use the 4 steps of non-violent communication within yourself or others, right? When you feel you are struggling with yourself about something, go there in the material and try to do the steps. How do we feel when you try to apply this light technology? Try to perceive this and take notes to yourself. And we have semesters too, to fulfill the self-care canvas. If you have already fulfilled it, try to check if there's any new ideas after this meeting. You can include that. Or even if you are a more advanced student, you can make another self-care canvas about something else you want to achieve in your evolution and care. And we have 2 suggestions of series and animation to you. I'm not sure if you have already watched the Painkiller series on Netflix. Very good, right, Magali? And the movie Pain Hustlers. And we also have this animation, a very small one, very cute animation about nonviolent communication. It's a really good one. And very good. We are going. Remember that these are our self-care canvas. And we thank you again so much for your attention, your time, your sharing. Thank you. I'm going to stop sharing, right? Okay.
Thank you
So
so much.
exactly on time, right?
Yeah.
Thank you.
Thank you. Thank you. Thank you so much.
And yeah, so I think the next meeting will be our last one. So I'm saying this to myself as well. Let's all make an effort to do the homework, get the most out of this by bringing ourselves into it, bring our own energy into it. Yes, because every time we have these meetings, I really feel connected to this drive for self-care and, you know, being more conscious in that space of health. So yeah, thank you very much. Hope to see you all next month. And that's it.